Well, back in April, the governor announced the first of its kind task force on racial inequality and COVID.
Today, the task force is out with its first progress report. Rod Maloney live tonight with a look at where things stand and what they have learned. Rod.
Yeah, Devin, the governor and the lieutenant governor who chairs the task force are very encouraged by what they were able to accomplish, particularly when it comes to bringing the numbers down for COVID in communities of color. But they say the work is far from finished.
The average cases per million per day for African American Michiganders dropped from 176 to 59. In the same period, the number of probable deaths per million among African American Michiganders dropped significantly from 21.7 to 1.
Lieutenant Governor Garland Gilchrist spoke with Local 4 in advance of the governor's press conference and addressed what he believes helped bring those numbers down so significantly. And he says there were some simple solutions.
Connect people to doctors. Too many people did not even have doctors or primary care physicians, or were underinsured or didn't have health insurance. We've set up a navigator program to help people who are getting a COVID test and are coming into contact with a medical professional to connect them with a doctor, so that even if they get a negative COVID test, they now have someone to work with on their other health outcomes.
He pointed to other steps taken, like distributing 6 million free masks across the state, a third of those for children, and specifically targeting communications in communities of color on what to do to avoid COVID. Despite the progress shown, though, the governor says
our number of COVID-related cases and hospitalizations is still dangerously high, and dozens of Michiganders are losing their lives to this virus each day. We must continue to work together to protect each other.
Now, the governor also talked about some of the other things that they were able to do using the task force's leadership, doing 20,000 tests in underserved communities and also opening other testing sites. And it brought some of the care to the communities that hadn't been there previously. Back to you.
Well, Rod, what is the state going to do in this area now looking ahead?
Well, one of the things that they say that this has enabled them to do is to have a footprint, a blueprint on how to get the vaccine distributed once it becomes available. They say that may be the most important thing that comes out of this, is to be able to distribute the vaccine and get it out there quickly.
Sure. All right, Rod.